So the next speaker is Dr. Farheena Kulsum. She is a fellow at Sadhguru Netra Chikitsale and her topic is effect of vitamin D supplementation on PEGF and PEDF in diseases of posterior segment of the eye.
Good morning, everyone. My topic for presentation is effect of vitamin D supplementation on vascular endothelial growth factor and pigment epithelial drive factor in disease of postsegment of eye. So as we all know, the pathological hallmark of the leading causes of blindness is a dysregulated choroidal or retinal neovascularization. VEGF and PEDF is known to have a crucial role in the developmental and the pathological angiogenesis. However, vitamin D is a modulator of oxidative stress and angiogenesis. There are dearth of ocular studies showing the relationship of the same. To fulfill these lacunae, we have undertaken the present study with the following objective. The objective is to study the effect of vitamin D supplementation on the levels of VEGF and PEDF in patients with disease of posterior segment of eye. It was a double-blind, randomized and placebo-controlled trial in which 93 patients were undertaken. Study group contained 60 patients with disease of post segment of eye, and this was further randomized into subgroup A1 and A2. A1 group received vitamin D supplementation, A2 received the placebo. Group B had 33 age and gender match healthy patients. Fasting blood plasma were collected, and vitamin D and serum VEGF and PEDF was measured at the time of enrollment and after 3 months of supplementation. This was the exclusion criteria. After proper statistical analysis, coming to results. Distribution of cases in the study group, out of 60 patients, mostly patients were of diabetic retinopathy and followed by RVO and ARMD. These patients were randomized to receive either oral vitamin D therapy or placebo for a period of 3 months. If we see at the demographics of the study, difference between the mean age of the patients and the gender between the two groups was not statistically significant. Coming to the comparison of baseline variables between the study group and healthy control, serum vitamin D concentration was found to be significantly lower in the disease group. However, serum VEGF and PEDF was found to be significantly higher when compared to the healthy controls. Out of the 60 patients in the study group, 24 patients were lost to follow-up. Comparison of variables between the intervention and the placebo group. At baseline, there was no significant difference between the mean serum vitamin D concentration. However, at 3 months, the mean serum vitamin D concentration was significantly higher in the intervention group. If we look at VEGF, at baseline, there was no significant difference in the mean serum VEGF. At 3 months, there was significant decrease in the serum VEGF in subgroup A1 when compared to placebo. And similarly, PEDF was also decreased after 3 months of vitamin D supplementation in intervention group. However, it was not statistically significant, but the change in the PEDF was significant. Coming to correlation between vitamin D and study variables, so serum VEGF and serum PEDF was found to be negatively correlated with vitamin D, and this correlation was statistically significant. Coming to discussion, retinal angiogenesis is the basis for vision loss in several major blinding diseases. Oxidative stress affects the RPE, leading to the development of the vascular eye disease. Vitamin D, on the other hand, is a known modulator of oxidative stress and angiogenesis. These are some non-ocular studies in which authors highlight the potential use of vitamin D in both the prevention and the regression of conditions characterized by pathological angiogenesis and inflammation. And in the animal studies also, the authors have proved the same. Despite the reasonable rationale provided by the above discussed association data, prospective studies on the effect of vitamin D supplementation post-segment disease of the eye in humans are lacking. This is my conclusion. After vitamin D supplementation, there was mean decrease in the levels of VEGF and PEDF in the intervention group, and it was found to be statistically significant. Due to anti-angiogenic effect of vitamin D, it can be used as a supplement to the current management guidelines of posterior segment of eye. Thanks, ma'am.
Thank you, Dr. Kulsum. In the intervention group, in the the study group, you had 2 groups, one with intervention, one without intervention, right?
Yes.
Even that one which did not have intervention also had deficiency of vitamin D. Why they were not treated? Is it right ethically to exclude them by not treating?
No, sir. Actually, we followed up the patient for. We were in control. We were seeing like they had the vitamin D, but that was not that much low that it.
No, your mean was less than 16. You said actually, yeah. And number 2, like any of these patients had macular edema, which warranted any anti-VEGF injections.
No, sir.
Hello? Hello? Hello?
Dr.
Dr. Salil.
Hello.
Take this mic.
No, sir. No, sir. No, sir. Yes, we do it at the baseline, obviously.
No, no, they have done, they have done.
Baseline.
The mean was 16.
See, one more comment, Dr. Salil. See, this posterior segment disease, it is a subject. See, there is a number of posterior segment diseases. I think you should have specified a particular disease, maybe diabetic retinopathy, maybe vein occlusion.
Yes, sir.
Instead
I have
of
specified that.
there, but your topic is in the posterior segment disease, isn't it?
Yeah, in the topic it is post-segment disease.
See, posterior segment disease is a general term. It is a book.
Yeah,
You know,
in the inclusion.
for three volume books of Rayan covers the posterior segment disease.
Yes, I
You
should
be
have
specific. Maybe diabetic retinopathy, maybe vein occlusion.
Yes.
Otherwise, it becomes quite
Yes.
vague. This is
No, I saw headings, three headings that inflammatory,
Edematous and
proliferative and
proliferative.
this. But in the results, you didn't
I have done
group
in
that and tell the correlation. Maybe that was the thing, right? What was the dosage followed? Vitamin D?
Vitamin D, ma'am, we gave it for one weekly. We give 60,000 unit in the loading dose, and then on the maintenance we keep for rest of the 2 months.
Yeah. And then did you check, after how many days did you check the vitamin D levels?
3 months.